On your adult care qualification, you will be asked to answer questions about your role and responsibilities. You will have to discuss it in respect of different units. However, there's a couple of questions where you specifically talk about your role and responsibilities, about everything that you do as part of your role, but also the limitations of that role. So how to answer that question so it's not sent back to you. Don't just list your duties and responsibilities. Pay attention to what command verb you need to meet. So think about everything that you do. The best way to answer that question is to describe your day, your ordinary day at work from the start to end. Think about things like a handover, who you communicate with, what do you do, but also include things like reporting concerns, attending training, record keeping, which I've noticed learners very often forget to include. So that's that first element, what you do, describe it. Then how you do it, how do you carry out those tasks, what sort of maybe training you need to have to be able to carry out that specific task. Think about specific tasks like moving and handling, or maybe medication. What would happen if you would do them without that training? What would happen if you don't follow a care plan? Because remember, part of your role is also to follow a care plan. And then point 3, why? Why is it important that you do? Not in a specific way. What's the reason for you, your purpose of your role? Then the impact. How does it support the individual? So how you work, what's the impact of how you do those specific tasks on the individual? Think here also about the quality of the care that you deliver, the impact on the organization as well, and support everything with the examples. Examples give credibility to your work, but also show that this is your own work.